everyone. My name is Christine Graham. I'm the Executive Director at the Ophthalmology Foundation, and we're excited to have you here today for our second in the webinar series of this year for faculty development, teaching professionalism and ethics in ophthalmology education, case-based and problem-based learning, hosted by Dr. Siddiqui Alamu. So just a little housekeeping. Use the Q&A box rather than chat for questions, and we will get back to you. The webinar is being recorded, so you can reference this later or share with your colleagues, and that will be available within 24 to 48 hours and automatically mailed to you. So just a little background on the Ophthalmology Foundation if you're not familiar with us. Our focus is working with eye care professionals, societies, organizations, industry, to provide ophthalmic education with a special focus on low resource and underserved areas. So helping ophthalmologists be better teachers, such as we are here today for, providing training opportunities through subspecialty fellowships, administering affordable, accessible examinations, and offering program and accreditation so that programs can improve their abilities and capacities for training and producing excellent physicians. So our main areas, like I said, are examinations. We have 3 standard exams in visual sciences, optics, refraction and instruments, and clinical ophthalmology. And next year we'll be launching subspecialty exams in glaucoma and retina. We have 3, 6, and 12-month fellowships for young ophthalmologists, typically under 40, from low resource areas to join a training program in a high resource setting, to gain in-depth knowledge, mentorship opportunities, experience, and well-funded programs to go back home and bring up the quality of eye care in their home country. Faculty development, which we are here for, tools, techniques, and resources to help you better train ophthalmologists and eye care professionals. And as I said, accreditation to help training programs meet global standards. So I'm very happy to hand over to Dr. Siddiqui for today's webinar.
Thank you, Christine. So my name is Adek Samno. I'm originally from Ethiopia. I'm an ophthalmologist, vitreoretinal retinal surgeon, and a medical educator. So today we are going to discuss on teaching professionalism and ethics in ophthalmology education, and with a focus on case-based and problem-based learning. So our objectives for today is to be able to apply case-based learning and problem-based learning to teach ethics and professionalism, and on how to guide our students or residents to use a structured framework when analyzing an ethical dilemma or professionalism case scenarios that we present to them, and also to design authentic cases and problems to teach and assess ethics and professionalism in ophthalmology education, and also discuss some assessment methods which can be used for professionalism and ethical reasoning. So to start with, since our topic is on case-based learning and problem-based learning, we'll start with a case. So let's look at this case. So there's a senior final year ophthalmology resident who is widely regarded as one of the strongest trainees in the program, and the resident consistently achieves excellent examination results, demonstrates outstanding surgical skills, and manages complex clinical cases with confidence. However, there were multiple concerns about having been documented over the past 2 years. The resident is documented as frequently being disrespectful toward nurses and junior colleagues, manipulates duty schedules to avoid less desirable assignments, and often transfers patients and clinical responsibilities to other residents without appropriate justification. So this results in unfair workload over the team, and they have been complaining about that. So which statement do you agree with most? Okay, so Jody will project the poll for you, which is the first point is base that decision primarily on patient outcomes and patient safety. Is it deferring graduation until professionalism concerns show measurable improvement, or graduate with a formal mentoring and professional development plan, or graduate with clear feedback on professionalism concerns? So I'll let you think about it for a minute. Okay, shall we end the poll and see our results? Okay, interesting. It's distributed across the three. So, which means all of you have a different opinion about this. So, of course, one way of dealing with it is to defer graduation until professionalism concerns show measurable improvement, which seems like a conditional thing where at least a person who has chosen this feels like that part of professionalism is critical for graduation. And then there's a developmental approach where, there is a formal mentoring and professional development plan. But then the last one is more like if we feel like the professionalism, we have confidence that the professionalism will improve along the way. But none of you considered the first one, which is based that decision primarily on patient outcomes and patient safety, which tells me that at least all of you would feel like professionalism is an integral part of the competency and not just patient outcomes and patient safety. So we'll see if we have the same idea at the end of the course, the webinar, I mean, so we'll see. So when we talk about not only ethics and professionalism, but any competency and any knowledge, so this is a very old pyramid, but it shows that there is always that level of knowledge that we build on, which is first it's just a raw fact, then we try to make meaning and organization out of it. So we try to understand the what and organize it into a certain a guideline. And this is also true for ethics and professionalism. So we might have some organized facts and figures or observations or raw measurements or numbers, but then all those numbers and figures would have to make a meaning through some organization into guidelines, say policies, case details, and research findings, and that conforms some of the guidelines that we have for um, ethics and professionalism. But then, of course, it becomes knowledge when we actually integrate everything into the context, understand it very well, and make some codes out of it or ethical principles and so on. But knowing all these ethical principles and professional codes doesn't guarantee that you would actually act upon them. So at the end of the day, there needs to be a wisdom where you have to apply with judgment for the greater good or any ethical lens that you you see it in, and that would have the impact on the people and the society. So ethics and professionalism um, is kind of without the wisdom, it is really difficult to to achieve with just data information and certain knowledge. So why this matters even more in the era of AI now? Because for knowledge, AI is excelling with tremendous amount of data that is being fed into the AI platform, into the AI language models, and pattern recognition, imaging diagnostics. AI is still excelling on that. Even for clinical reasoning, it is becoming more and more powerful with AI increasingly assisting real-time decisions with informed decisions uh, being fed through the data and also pattern recognition, imaging diagnostics that help in the clinical reasoning. And then even in the future, there would be more and more AI-assisted surgical planning, AI-assisted robotic surgeries, and so on. So the involvement of AI is inevitable. So what still needs to be relevant would be the professional judgment that we have, which is still lies upon the human responsibility. The ethical decision making that we have to make that still lies on us, whether how and when and which type of AI that we use will still have to be ethical, and at that point then it would be a human responsibility. And again, in the previous webinar that we had about AI use, we already stated that we have to verify. Okay, so if we have to trust it, then we have to verify, and that also is dependent upon human responsibility. For that to happen, then that's why the focus on professionalism and ethics it becomes even more important at this age of AI. So another poll for you now. Okay, so now that we understand that ethics and professionalism are important, but then how do we teach it? Yeah. So thinking back to your learning, where did you learn most of your professionalism and ethical behavior from? Was it from lectures? Was it from case-based learning, problem-based learning? Was it driven by assessments that were through faculty or different methods? Was it through the peer and workplace culture, or was it through your own personal reflection after challenging patient encounters? So I'll also give you a minute to think about this, and you can choose. Okay, let's end the poll and see the results. Okay. Yeah, I think from the polls, I think when if you said Pearson workplace culture, which is very important in terms of most probably we role model others in terms of ethics and professionalism, and then personal reflection after challenging patient encounters also had a vote. So that's interesting. So when we talk about teaching um, and assessment and so on, and overall the curriculum that we have in our ophthalmic education or medical education in general, we need to think of the different, overlaps between the curriculum, the types of curriculum that we are talking about. So typically when you talk about the curriculum, we usually talk about the declared curriculum, which is the document usually. That's the one that people always refer to. But yes, that is important. But it is what we say is important, and these are formal statements which are written there. And I'm sure many of the curricula that we have now uh, are based on well-known competency frameworks and usually contain competencies related to professionalism and ethics. And the problem is, do we actually teach it? So just because it's in the curriculum, the declared curriculum, it doesn't mean it is taught. So there is an overlap between the declared and the taught curriculum, but that overlap is not complete. So what's explicitly taught is is evidenced by the planned learning activities, discussions, and intentional role modeling and learning experiences that we want to plan for our students. But then, just because we teach it, it doesn't mean it is also assessed. Sometimes we teach it, but then we don't assess it. So there's an overlap between teaching and assessment. We sometimes assess it. We sometimes we don't. So usually assessment drives learning. So the students will focus more on things that they are assessed on, and if the focus is more on other clinical competencies, then they might not focus on professionalism and ethics. So it influences on what learners prioritize and learn. So, um, as you previously said, peers and the workplace culture are not explicitly stated usually in the curriculum. So this is what we call the hidden curriculum. These are the unspoken messages that learners just pick up from the culture, the workplace culture, the educational learning environment, from unintentional role modeling. Sometimes when we role model, we don't always role model good things, but also bad things, and behaviors and values that are demonstrated in that environment will lead to that hidden curriculum, which is not documented anywhere. And then there's also the experience curriculum with all these things, with the teaching, with the assessment, with the document available, and with all the hidden curriculums through the environment. There's also what the students actually internalize and experience. So what they live through in real situations and how they reflect on them and what they take up as a value or a professional identity. That's what we call experience curriculum. So all these things, if they overlap well into the central part, then that forms the professional identity that we want with ethical reasoning, professional judgment, these values that we want in the practice, the trustworthiness, accountability, patient-centered care, all these things can happen if all these things kind of converge into the center. The more these ovals are taken apart, the more there's less alignment between what is intended and what is experienced by the students. So to nurture this professional identity and ethical practice, then we need to make sure that all these things are aligned. So again, there is a lot of debate on what ethics and what the distinction between ethics and professionalism is. But this is kind of a general comparison where, ethics usually is not just a medical education or ophthalmic education concept. It's a general concept. So it focuses more on what is right. So this is based on the principles and values, intentions and decisions, and these are usually based on universal principles. Um, Professionalism is not just about what is right, but how we do what is right. So doing it the right way. So there's definitely a lot of overlap between these two because they are both value-based. They both promote well-being of patients in society. They require a certain level of judgment, and they shape professional identity. And the good thing is usually in medical education and in ophthalmic education, the overlap between professionalism and ethics is so big that one doesn't negate the other. So ethics tells us the right thing. Professionalism helps us to do it right every day. So when we try to use some teaching methods for professionalism and ethics, case-based learning and problem-based learning are really important because ethics exists in uncertainty and dilemma, and these cases helps us to show those dilemmas and there's no learner who becomes ethical by just memorizing the ethical principles through lectures. So they become ethical through encountering those dilemmas, debating those values, reflecting on consequences, and defending their decisions. So what is CBL? So when we talk about case-based learning, usually there would be some prior knowledge and prior reading of materials. Maybe it could be ethical principles or professional principles, and then once you expose them to that, or to the basic knowledge about those things, then you you come up with a case which can show whether they can apply all those things into that case. So you are the one who facilitate it more, and you have those learning objectives so that they can analyze based on those learning objectives. If they want more info, they can ask more info about it. At the end, you want them to solve the case. Okay, so there's the there is the analysis of the case, and in the end you would want the solution for the case. And usually this CBL is usually good for when the solution is very clear. Okay, when the solution is based on a certain code of conduct or a certain ethical principle which is really clear in the case, and so on. But if you want more challenging dilemma, then PBL could be a good one, because actually the cases would be really a problem for them, and the students don't need to be taught about the principles or the codes and the medical legal documents and so on. You don't need to expose them to those things. They actually are exposed first by the problem. They brainstorm on the problem, and they identify what they need themselves. So if they during the brainstorming, they know what they lack, and they have their own learning objectives. So they do their own self-directed learning to actually find out how to solve this type of problem, whether it's a professional or ethical problem. So usually in this process, the synthesis that they come up with after self-directed learning will be really open-ended, and your involvement as a facilitator will be little. So let's see the differences between CBL and PBL in that sense. So when you use PBL as a method, then it is more open inquiry, whereas when CBL, it is guided inquiry. There's no need for pre-reading during the problem-based learning, because they are supposed to actually find out what they need. Whereas in CBL, you kind of are using the CBL to actually show the application of what you have taught them. And your involvement is less in PBL and more in CBL. And PBL is more comprehensive in terms of collaboration, ethics, professionalism, communication, problem solving. It's a generic skill that you are actually um, teaching them, because whenever they are faced with any type of problem, any type of ethical problem, any type of professional problem, they know what to do, they know how to solve it. Whereas in CBL, you are more guided towards that specific scenario, on how to solve that specific scenario. So when you use CBL, you are more concerned about how to solve a similar problem when they are faced with a similar problem, whereas in PBL, it's more generic. So after the session, there's a lot of post self-directed learning in PBL, whereas in CBL it is less. So generally in PBL there is more concern about the process, whereas in CBL it's more about the final product, and the students actually come up with their own learning objectives in PBL, whereas in CBL it is more faculty guided. So the cases will be also less structured, open-ended in PBL, whereas in CBL it is more structured, more closed-ended, with all the important information available. So how do we develop cases? So when we develop cases, then of course it has to come with a constructive alignment with the competencies that are needed for that level, for that context, and for the considering the emerging, also changing, ethical and professional issues. We need to update ourselves with that. So things that were considered non-ethical at a certain period of time, maybe ethical at this point. It might also be professional before and not professional at this point. Although many of the things that we know of are usually based on universal principles. So when you go for specific cases, then we have to be careful about the current context and emerging issues. So what are the types of good cases? The good cases are cases that have ambiguity, some kind of dilemma. They need to have some kind of conflict with two or more ethical principles in conflict, whether it's autonomy, beneficence, non-maleficence, justice. All these issues have to be in conflict to show the reality. There should be some kind of professional tension if you are considering a professional related case, which is related to competing duties, personal values, culture, and there needs to be a certain level of uncertainty. So you don't need to provide all the information because uh, authentically, not all cases that we face have all the information that we need. There needs to be some emotional touch to it, and of course, they need to be authentic, something that can happen tomorrow, for example. So there are a number of cases that you can think of. I've come up with some cases that you might think of, some topics. For example, if you want to talk about justice or equity or resource allocation, then you can think of, the last cataract surgery slot, and when you have to select few people out of many in a surgical outreach. If you want to talk about global health or professional responsibilities, then a visiting surgeon from some abroad needing to have a qualification or a license, for example. A driver with advanced glaucoma now, then that's a little bit of a dilemma about confidentiality, public safety. One-eyed patient refusing surgery. If you want to talk about consent or shared decision making, um, expensiveness of anti-VEGF could be a good topic for advocacy, access to care. Brilliant but difficult residence, if you want to talk about professionalism, even education related ethical issues, professionalism issues related to the surgeon mistreating others, reporting and documenting surgical errors, AI now, AI related issues, or, those related to, conflict of interests, commercial influence. All these are good topics that you can use to for CBL or PBL. So let's try one. Okay, let's try one. So a 74-year-old female undergoes phacoemulsification on her right eye, and during the insertion of the intraocular lens, a small asymptomatic posterior capsular tear occurs. Then the vitreous remains completely stable with no vitreous loss, and the lens is safely and securely placed in the sulcus. Postoperatively, the eye is quiet and the visual prognosis remains excellent. The patient is currently resting in the recovery lounge and is unaware of the intraoperative micro complication. But her daughter has mentioned before that her mother has anxiety and panic disorder. So would you go for disclosing the capsular tear precautions and just do some precautions and referral? Would you hand the case over to a senior colleague for the follow-up and disclosure about this micro complication? Or would you omit this capsular tear to avoid unnecessary panic and just educate on precautions and follow-up care? I'll also give you 1 minute. Okay, let's end the poll and see the results. Okay, so there's halfway between disclosing the capsular tear and omitting it. So you see, just answering it like this, just if you just use this one, for example, for an exam, then it might just be uh, a yes or no answer, or kind of the answer by itself is not enough. Okay, because you want to know why the student is actually choosing that, with why you are using it, would be why you are answering is more important than the answer itself. So one can argue that disclosing the capsular tear and precaution, just disclosing it would be not in the to the benefit of the patient, although disclosure is very important. They might feel like for the greater good, uh, the mother could be having more anxiety and panic, and this could lead her to more problems. Somebody could answer handing the case to a senior colleague would be better, because maybe they feel like an experienced person could handle the disclosure of this problem in a better way, in such a way that it doesn't arise anxiety or panic. Or somebody could say that disclosing it is very important, because if someone, for example, during follow-up just does a YAG laser or something like that, then it could lead to further problems, and that could lead to even more panic and anxiety on the patient. So all of these options could be appropriate, and that's how actually you should, if you are using this as an assessment method, then that's how you should phrase all these questions in such a way that the distractors are plausible. But then it is more important to actually grade each of these things with an expert to say that which one is the most appropriate in this situation. Okay, so depending on the level of the the resident who actually did the surgery, or the experience of the surgeon, then um, most experts would say that, disclosing it uh, in a very clear way, but not in an intimidating way, could be done without raising anxiety and panic. It just takes the communication skill on to do that. So if most experts agree on that, and if you're then that would be the answer. But then it's more important to discuss on the reasons why, rather than just choosing the answer. Okay, so that's why the frameworks actually help in analysis. Okay, you can use different frameworks to guide your students on analyzing ethical cases. For example, you can use this one where you start with clarifying the facts, what happened, what is uncertain, what is information is needed, then identify stakeholders who is affected. In this case, the the mother, the daughter, the family, you know, even the hospital, who is could be a stakeholder in this, and also the doctor himself could be a stakeholder. Whose values matter most, Okay, you want to be patient centered. So who is vulnerable? Okay. Now, who is accountable? Vulnerability could also be depending on each of the stakeholders. So then you define the ethical dilemma. This is, in this case, now it is disclosing the information versus, the safety of the patient in terms of, the panic and the anxiety. So you can talk about that, and which ethical principles are in place. You are trying to avoid harm by disclosing. Eh, so it might be non-maleficence, but then the patient has a right to know whatever is done to them. So these conflicts can be discussed. And then what are the options? Okay, then the options are there. And then what are the alternatives? Yeah, and then you have to justify each option, why you actually chose that option. That way, you can have a sensible reflection in the end, and this guide helps them to analyze the cases rather than just choosing one answer. Um, but again, how to analyze these options could be done in different ways. Okay, if you are talking about ethical analysis of cases, then you you can have a philosophical approach where you use utilitarianism, deontology, right-based virtue ethics, or casuistry, or other philosophies. But this could be a little bit more difficult in the sense of making it practical. But when you talk about utilitarianism, it's more about the greatest good for the greatest number. It has its own advocates for that. Or is it about duty? What is my duty? So my duty is to tell the truth all the time, or to have integrity, to tell everything. What is the professional duty? So in each of these lenses, you could arrive into different solutions. So you could help the students choose each lens and then say which one is the best way to go about it. But then the philosophical approach depends on how much deep you went into each of these philosophies during your teaching. So if you didn't go deep into that, then it might not make sense to use this as a framework. Maybe you could use a more clinical approach of this is called the four quadrant approach, where you talk about more the medical aspect, the patient preference, the contextual features, and at the end, what type of quality of life you expect from that certain decision. So in terms of medical, you focus on the medical risks and benefits. Okay, if I tell the patient this, what will be if I don't tell this patient that there is a minor complication, what would happen? Okay, what are the risks and benefits? And what is the likely outcome? Or what would be the patient preference? Would the patient prefer being told some um, small complications which might not affect them, or would it be the other way? Would the patient actually want full disclosure? Then you have to analyze that. Then what would be the quality of life and some of the contextual factors, including the family, cultural, ethical, legal issues that surround all these decisions have to be analyzed. So you can use either of the philosophical approach of the ethical lenses or the four quadrant approach to analyze the ethical cases. So when we revisit this case, then it will not be just choosing one answer for this. You will have to analyze each option based on each of the lenses, ethical lenses, or the four quadrant approach. If you are going for a professional case, then that's also possible to talk about, what are the observed professional behaviors, you know, can we identify some of the professional responsibilities which were missed or adhered to? Can we analyze the alignment with the professional values, including integrity, compassion, respect, accountability, excellence? What should the professional have done? Were the alternatives, including patient welfare, public trust, professional integrity? So at the end of the day, then professionalism is about commitment to the self, to the patient, to the community, and to the profession itself. So you can consider all these aspects. Then consider the impact on the trust and relationship that you would have with patients, families, colleagues, wider community. For example, in terms of using social media and for other purposes, and then if there is any inappropriate social media post from physicians, you can use that as a case. And could it impact, you could raise the issue of could it impact the trust and relationship that you have with your patients? That could be a discussion point. And how can we plan for professional growth? And of course, at last, we have to reflect and improve on that. So you can use these frameworks. It's not it's just a suggestion, and it's not a rule, but things that can help the students analyze the cases would be nice. So let's once we teach about ethics and professionalism using cases and problem-based learning. Then at last, of course, we would want to assess ethics and professionalism. So here's another poll for you. Which of the following do you think would be most likely to predict future professional and ethical behavior in clinical practice? So is it knowledge of ethical professional codes and regulations? Is it performance in OSCE stations? Is it performance behavior on workplace-based assessments or self-reflective practice regarding growth and commitment? Again, I'll give you 1 minute. Okay, let's end the poll and see. Okay, so all of them are important, yeah, to assess ethics and professionalism. But the prediction of just knowledge of ethical professionalism and codes and regulations doesn't guarantee you that, just because you know ethical principles are, autonomy, beneficence, non-maleficence, and justice. If you just ask the students, they will list down all these principles. But then that doesn't always translate into actions. Yeah. In OSCE stations, we can integrate, those ideas in each of the stations that we use. We can integrate some attitude-related components in our checklists and global rating systems. We can still check that, but usually what happens is OSCE is just a performance um, in a simulated setting and not really the reality. So usually in work, what is observed in the workplace is very important aspect of assessment of professionalism and ethics. Of course, self-reflective practice is very important, but it's liable for self-bias, self-related bias, whether it is being too critical about yourself or being too praising of yourself. So I think all aspects are important, but we have to think about the labels. Yeah. So whenever we think about whether it's ethics and professionalism or other competencies, there are labels considered in Miller's pyramid, which is the first level is knows, just the knowledge, fact, and understanding, and then there is the know-how, which is more about application of that knowledge. Um, so in the lowest level of just knowing the basics, asking MCQ questions about ethical principles and so on, or short answer questions or e-learning quizzes could be enough. But then if you want real application of knowledge, then we have to use cases that can check whether there is ethical reasoning or not. And you can use those situations to see how the students actually judge those scenarios. We call that situational judgment tests. And there are also what you call defining issues tests. These are very peculiar tests which may not be available all the time, but you can check them out. They are also similar to case-based analysis of cases. And there's also what you call script the concordance test, which is related to um, the analysis of the students versus the expert analysis of the options. Then we can go for OSCE, of course, as I showed you, thought about that. And you can use it, role play or standardized patients or scenarios. You can also check using um, ethics specific OSCE stations. But then for performance, you need to use workplace-based assessments like mini clinical evaluation exams or professionalism specific exam tools that you can use called PMEX. You can use DOPS or direct observer procedures. You can use multi-source feedback, which is a feedback from everyone around whether it is patients, nurses, colleagues. You can use team assessment. You can use professional behavior indicators. You can go for all these things in terms of DAS. Now there is an updated Miller's pyramid, which is called EASE, which is just because you perform in the internship or in the observer behavior doesn't always lead to professional identity. So this professional identity is having those values and characters in practice. And for that, all the workplace-based assessments plus some interest level professional activities where you grade the student whether they could be trusted in a certain scenario or task could be one way of checking values and character in practice. So with that, let's reflect on the first case scenario. Maybe we can pull up the poll again for the first case. So do you still believe that you have to base the decision primarily on patient outcome and patient safety? Do you defer graduation until professionalism concerns show major improvement? Do you go for graduation with a formal mentoring professional plan, or do you go for graduating with just feedback and for the student? I'll give you another 1 minute and we'll see the result. Okay, let's end it and see. Okay, some of you have shifted to the primarily based on patient outcome and patient safety. Defer graduation until professionals' concerns show major improvement. So I think it also depends on what at the end of the day it depends on what we have done to actually make sure the senior final ophthalmic resident doesn't reach at this point where we will be faced with such a big dilemma. Okay, what we need to intentionally teach our residents so that we don't have such type of dilemma at the end of the year, at the end of their almost graduating year. We have to make sure professionalism and ethics are taught well in the right way and also assessed across all the years, so that remedial actions can be done before graduation, before reaching at the final stage, at the final hurdle, so that we are not faced with such problems. So the key takeaways for me would be teaching and assessing ethics and professionalism in the AI era would still emphasize would lead to less emphasis on knowing the answers, more emphasis on judging the answers, why you actually chose that answer, less emphasis on information acquisition, more on wisdom. And of course, professionalism and ethical identity is not achieved just because it is there in the curriculum. It emerges from what and how we intentionally teach and assess, what students learn from observation, experience, and self-reflection. So that is it. And for further information, you can contact me here.